Hey, I'd like to welcome you to another episode of the Mission Matters Startup Garage podcast, your source for all things startups. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Laurence Girard on the line, and he's a CEO over at Fruit Street Health, and he's also a host of the Digital Health Entrepreneurship Podcast. Laurence, welcome to the show.
Thanks for having me.
Oh, man, so excited to get into today's episode. So we're going to get into Fruit Street Health, and I also want to talk about your podcast, so Digital Health Entrepreneurship, which you launched last week, so I'm happy to help bring that to my audience. But just to kick us off, tell us a little bit more about what you're doing over at Fruit Street Health, please.
Well, Fruit Street is a telemedicine company, which everyone's seeing in the news now because of COVID-19. Everybody's at home. They have to do their healthcare online. But we actually have three different products. The first product is a telemedicine software product that we license to physicians and other healthcare professionals so that they can do HIPAA-compliant video conferencing with the patients in their practice. Every doctor wants a virtual healthcare solution right now because of COVID, so that's become quite popular. And then the second product is that we deliver the Center for Disease Control and Prevention's National Diabetes Prevention Program through video conferencing with dietitians. So that program is designed to help people with prediabetes, which is elevated blood glucose, lose 5 to 7% of their weight to reduce their risk for developing type 2 diabetes. So it's 26 classes with a dietitian and a group of other participants covering topics like diet, exercise, sleep, stress management. You will get a wireless scale, a Fitbit, and you can take pictures of your food in our mobile application to get feedback from your dietitian. We also have a partner, Purple Carrot, that will deliver you healthy plant-based meal kits so you can do some delicious plant-based cooking at home. And then our third product is brand new, which is really a pivot because of COVID-19. It's called COVIDMD.com. So it's a national telemedicine service where the public can come to our website and take a risk assessment to determine their risk for COVID-19 based on their symptoms and that kind of thing. And then they can video chat with the doctor, and that doctor will provide them with advice. And in the coming weeks, we're hoping to get FDA approval to do at-home test kits where we could actually send you a test and you would be able to send it back and get your test results. But then eventually we want to deliver, long-term care. So things like virtual primary care, psychiatry, psychology, dietitian services, other types of services that Medicare is actually willing to pay for now because everybody is at home. So that's really what we do. And we've raised about $20 million of capital from 300 physicians who invested in the company. So one unique thing about the company is that we're completely funded by physicians.
Wow, what an amazing story. And I love it because you have multiple verticals that all are multiple niches. You're hitting all within the same niche, I should say. And you're addressing a couple of problems. Number one is the what's going on in COVID right now. You're hitting that from two different angles. I want to talk a little bit more about the telemedicine movement because I don't want to assume that everybody and somebody might be watching this video in 2 years, right? So I want to kind of document what's going on right now. So tell us a little bit more about the opportunity you see in the telemedicine movement.
Well, the telemedicine industry has been slow to take off for quite a while now because Medicare has not wanted to pay for telemedicine when the patient's at their home. They will only pay for telemedicine when the patient is at another doctor's office, which doesn't make any common sense, right? But they finally have decided to allow Medicare patients, so over this age of 65, video chat with a doctor from their home and get things done like a doctor can write a prescription and that can get delivered to you through services like Amazon PillPack. But basically it's completely free to, Medicare Part B beneficiaries, and they can video chat with the doctor. And, they might have a concern like, I have a cold. Do you think I need to go to the emergency room if I have COVID-19? So that telemedicine visit can prevent you unnecessarily from going to the emergency room and maybe getting exposed to someone that has COVID-19. Or it might be that the doctor can figure out your diagnosis and maybe they prescribe you antibiotics or flu medicine that gets delivered. Or it could be for other things, like maybe you're just really stressed and you need to talk to a psychologist. There's no need to go in person for that right now. You can do that online. Same thing for a dietitian. Maybe you want to lose some weight, so you just video conference with a dietitian on a weekly basis. So obviously you can't do surgery through telemedicine, but a lot of these other services you can do online.
So you're right in the middle of all this, and it may be too soon to tell. It may not be. So you may already have the data on this, but I'm just curious. So because there's a lot of discussion about new norms and what's next and this and that. To me, the telemedicine is not a fad because I mean I've only been to the doctor. I don't, knock on wood, I don't really get sick. I mean I had an eye infection once in the last maybe 10 years, whatever, and I was like I could have done that. As soon as they told me about all these telemedicine things, I'm like I could easily do that on my computer. They know what it is. It's fine. It's done, and I can get my prescription, and I can call the pharmacy, and they can deliver it, like everything, and be done. Instead, I had to, at that time, this was years ago, I had to take off a half a day of work. I had to go in. I'm like, my eye, like, so my question is, I don't think this is changing. So is there any numbers or any data or anything out there that's just showing like the market is loving this right now? I'm just curious. There may or may not be. It's a question.
Well, Teladoc is probably the biggest publicly traded telemedicine company. Their stock has skyrocketed. I haven't checked it recently. Stock like Zoom has skyrocketed as well. I think they're trading at like, I could be wrong, but I think it's something like 50 times revenue or something. But on the legislative side, there are states that have passed permanent regulations. Like in Massachusetts, they passed a telemedicine parity law, which says that the insurance companies have to pay for telemedicine at the same rate they pay for an in-person visit. Right now, Medicare is temporarily paying for telemedicine at the patient's home, but I'm speaking with, lawmakers and lawyers in Washington, D.C. that are talking about that being permanent. And I think that culturally, have tens of millions of Americans being exposed to telemedicine for the first time. Probably, the majority of doctor visits are being done through telemedicine now. Normally it's the opposite, where it's the minority. And so culturally, all these doctors, all these patients, all these politicians are seeing that telemedicine is being proposed as a solution on TV. So once you have a culture change, that usually leads to regulations changing. So I don't think we're going back to the old model anytime soon.
No, I love it. And I mean, in my little vantage point, again, your company is completely funded by doctors. So I like to think like not only do you have the pulse on the other side of the end use of the patient, but you also have the pulse of the doctors, not only voting with their dollars by investing, but also what kind of feedback have you gotten or have you heard from the doctor side? Because I feel like we don't talk about that enough. Are doctors liking being on the other side of that camera?
Yeah, I mean, some of them have been doing this for a long time, and others are doing it for the first time. So I think that most of them view it as the future of healthcare. They think that our healthcare system is very broken, and it's also very focused on treatment rather than prevention. And technology is a way to do prevention and also just make treatment more accessible. I mean, if you have a patient in a rural area, they might have to drive an hour even to get to a doctor. So telemedicine is great for that. And so I really think they think it's the future of medicine, and I get a lot of feedback from them. One interesting fact about our business is that they're not just investors, but we have like an online discussion forum using a software called Basecamp where they give us input hundreds of times per week. So it's kind of like this, instead of being funded by a venture capital firm, it's a grassroots effort of physicians that want to have a social impact in public health using technology. So I think a lot of them are frustrated with their job at the hospital. They went to medical school to help people and they just feel like it's not working. So they're really optimistic that technology is going to be the solution.
Wow, that's amazing. And yeah, I think what's going to be really interesting is I don't know how long it's going to take, and maybe it already exists. I don't know. But when the new group of doctors going through medical school have to take, there's going to be a course or something that's going to be like delivering through telemedicine or something like that. If it doesn't already exist, it may already exist. But I'm just thinking out loud. Like I feel like that will be the future. It's going to have to be integrated into how doctors are taught and how they deliver. I mean, things like bedside manner, other things like that, like how it's done on video, like that's going to be part of their world for many, I should say. Like you said, you're not going to be able to do surgery through telemedicine, but that being said, for a lot of the other things, primary care, other things like that, I mean, it's just a great system. It works. People like it on both sides. The doctors get the patients like it. So all good either way. That being said,
I was just going to share that actually there is discussion of doing surgery through telemedicine. Once we have 5G, the internet connectivity will be such that you could potentially do a surgery robotically that's completely remote. And also, there's definitely telemedicine in some medical school curriculums now. I'm not sure that it's a federal requirement yet, but that's definitely starting to happen.
Wow, that's amazing. So that being said, Laurence, if somebody's listening to this and they want to learn more about Fruit Street Health, and also let's get in your podcast. So I want them to check that out. The host of Digital Health Entrepreneurship. Let's definitely plug your podcast. How do they listen to that? Where do they find information on that? And then also, and how do they find more information on Fruit Street Health, please?
Fruit Street's website is fruitstreet.com, so fruit like apple, street like road. And our new product, COVIDMD, is just covidmd.com. And if they want to listen to the podcast, the formal full name is Digital Health Entrepreneurship with Laurence, Girard. It's on Spotify and Apple iTunes right now. And I think we're getting on a few other platforms, but right now they can just check that out, and that's where you find it.
Awesome. Well, Laurence, it's been great having you on the show today. Appreciate you coming on and teaching us more about what you're doing over at Fruit Street Health and the future of telemedicine. So thank you, and where we're at now. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget to subscribe to the podcast, leave me a review in the Apple iTunes Store. And if you're watching this on our YouTube channel, Mission Matters Startup Garage, definitely give us a subscribe there, but also leave us some comments on the video. I mean, love to know what kind of things you're working on and what's going on in your world. And Laurence, thanks again for coming on the show.